Good evening, everyone, and welcome to Have a Seat with Chris Hansen, back in New York tonight after literally 9 weeks in Michigan, suburban Detroit, doing the shows from there. What an amazing day. You know Vinny LaVienne of the Emergency Task Force. He's been on the show 5 or 6 times, and he has been leading a group of law enforcement, private industry, and government to help people who need anything from surgical masks to sanitizing liquid to food, to candy, whatever is needed on the front lines of our battle in this pandemic against COVID-19. And we went riding with him today and his task force all over town, virtually every borough of Manhattan. And we are putting together a television documentary that'll be eye-opening and very fascinating. But we met some people along the way who were kind enough to join us on tonight's show as we take you back to the front lines on COVID-19 here and across the country. And we have Dr. Suraj Saggar, who has been with us before from Holy Name Medical Center. He's going to bring us up to date in New Jersey, what's happening. Sister Nancy Downing, who is the executive director of Covenant House here in Manhattan, which provides housing and transition for homeless young people. Fascinating story there about how they're getting through it. John Samuelson of the Transit Workers Union. These are guys and women who are on the front lines, operating the trains, the buses, working on our aircraft. And it really has been a challenge for these folks, along with the paramedics and the EMTs here in New York City, who are represented by a union whose Vice President Michael Greco is with us tonight as well. So let's get right to it. Dr. Suraj Saggar from the Holy Name Medical Center in New Jersey, just across the river from me. How are you tonight? How are you feeling?
I'm good, Chris. How are you? Welcome back to the Tri-State.
I'm great. Thank you very much. Glad to be here and really kind of blown away by what I saw today in terms of this effort, this grassroots effort that has grown to help folks like you and everybody else who's going to be on the show tonight. You're in the thick of this at Holy Name Medical Center. What is the latest? What is the trend? Do you have reason for optimism tonight?
So I tell you, Chris, we certainly at this time are on the, as we say, other side of the curve, right? We flattened the curve. We actually crushed the curve, thanks to essentially, everyone, whether you're a first-line responder or you're someone who stayed at home and followed the public health policy rules. So we're certainly on the other side of the curve in terms of the number of new admissions, ICU admissions, death rates, et cetera. So, I tell people this is essentially our new normal. We have parallel worlds of still a trickle daily of COVID-19 patients coming in, but at the same time now setting up our medical facilities, our doctors' offices, our ERs, et cetera, to really kind of take a break and catch up to where we left off. We have a lot of people who may put off certain surgeries, elective procedures, and we really need to ensure as a healthcare system that we're able to take care of both sets of patients, the COVID-19 patients, but at the same time ensuring the non-COVID-19 patients who also, obviously deserve and need extensive medical care can get it in a fashion that's safe for them as well.
Across the river from where I'm sitting now in Hoboken, they are starting to reopen some of the retail shops, and the hope is that in the next week or so, things start to get back to somewhat of a normal. What's your greatest fear, Doctor, as we move forward here?
I have to say, I think this is shared by a lot of my colleagues. It's really that we're well aware that this whole idea of sheltering in place, this fatigue, if you will, has set in, and rightfully so. People are eager with the warmer weather, summer vacations, et cetera, to really go back and doing things, obviously, which make us human, social interaction, seeing friends, seeing family, et cetera. And, we don't want to be naysayers in the medical community. We want to be able to do both those things, making sure that we socially responsible way slowly unwind our social distancing in such a way that we can very easily intercede if we see a surge of cases anywhere in the United States, right? So we want to go from the social mitigation stage that we've been in for so long now and going back to the containment stage. That is, if someone comes down with COVID-19, we're very easily and able now with better testing, et cetera, and understanding of the disease process to subsequently contact trace and try to prevent the spread of COVID-19 before it really hits the community like it did back in February, March, and April. My fear, of course, is that we unwind too quickly and that our habits that we've really done such a great job in the last few months, we kind of forget those social distancing and personal hygiene habits.
It is Memorial Day weekend coming up. People are going to want to go to the beach,
Of course,
Jersey
yeah.
Shore. People are going to want to get out and walk around in urban areas and in downtowns and villages. Is it safe, do you think, for people to really get out there, or are we inevitably going to see another spike, if you will, in cases?
Chris, I mean, any of us in the infectious disease world, in the public health community, epidemiology, I think it's inevitable that we're going to see slow surges of cases going forward as we slowly unwind. I mean, I think that's just the inevitable result of coming out of quarantine. How do we prevent that from getting out of control? Is obviously being able to identify cases very quickly. So we need to do it in a socially responsible way, guided by strong public health policy, both at the federal, state, and local level, and also understand as a nation, as a people, that if need be, put on the brakes in terms of our social unwinding if the case arises, and be willing to go back, and backpedal, if you will. So I think if people are able to do that and accept that responsibility, yes, there may be more cases, but the healthcare system now is certainly better prepared than we were in January and February, then we can at least feel confident as much as we can that yes, going forward, there very well may be cases, but we can do it in a socially responsible way with the understanding that no one can predict the future. No one knows what the next several months may look like. And certainly we have to understand that the fall, there's a very real possibility the fall and winter, we could see not just small spikes, but incredible surges, perhaps as big as we saw back in the last few months. So these are a lot of variables in play. And I think it's better to understand that there is some ambiguity that exists despite all our medical knowledge. And for people to really, at the end of the day, are going to have to make their own smart medical decisions to keep their friends and loved ones safe.
As chief of infectious diseases at Holy Name Medical Center, what, in your opinion, and you've been in the thick of this for weeks and weeks now, what has worked here? What combination of things has worked in terms of treatment? Obviously, Americans generally have been very good at social distancing, self-quarantine, wearing the masks now, which initially we were told we shouldn't do, and now everybody has to, taking temperatures, rubber gloves, sanitizer, hand washing, all of that. But from a treatment standpoint at your medical center, what do you think has worked?
Yeah, before I even address that, I think it's important for everyone out there to realize it's not just the first line responders that have been doing a lot of hard work. We understand that staying at home comes with economic and social costs. So I think it's really important for everyone to, take a pat on the back and understand that they had a significant part to play in flattening and crushing this curve. Now, if we look at treatments at Holy Name Medical Center and others places across the country, we've come to understand that this virus has phases. There's the asymptomatic phase where someone may be infected but not really have any symptoms. There's the viral replication phase. So, Chris, what it means is basically the virus is replicating in the body because it needs a host to replicate. And during that time is when you feel sick and you have symptoms. A lot of people at that stage can subsequently clear the virus and they get better. But we know a small but yet significant percentage of people start having the inflammatory stage, that so-called cytokine storm stage. And then finally, we have the kind of the lingering fibrotic stage in the lung. So if we understand there's 4 distinct stages within this disease, different interventions, whether they're antivirals, steroids, anticoagulants, things that make your blood thinner, antibodies, etc., would work in different stages. So I'll just give a couple examples very quickly. Remdesivir, which has been in the news, would probably work much better early on as opposed to later. The convalescent serum, that is giving antibodies from people who recovered from disease, much better to give it early on in the course as opposed to later. If someone has a cytokine storm, that's when we start thinking about things like steroids, start thinking about something called monoclonal antibodies, that are antibodies that are trying to blunt the body's immune response to the virus. So again, this is a very simplistic presentation, but it's for people to understand that this virus is very variable in how it presents, is very variable in its clinical presentation, and it has different distinct stages that we're understanding better, anywhere from asymptomatic to people having high fevers, to developing to respiratory distress, to being intubated. And each stage has different interventions. And until we get a definitive herd immunity via vaccine, we're going to have to continue to define and refine and develop our different interventions in each one of those stages.
What about hydrochloroquine? and I'm not going to drag you into a political battle here, and you know why I'm asking, but
I appreciate that.
I mean, you're a medicine man, and we know this, and you're not taking sides from a political standpoint, but you can't help but ask the question, if you're me, what a guy like you thinks about this, especially when the president is touting it. I've talked to other frontline medical people and who said, we just throw everything at it. You know, we do whatever has to be done to try to get under control. What do you think about hydrochloroquine? Sure.
So, Chris, the beautiful thing of this pandemic happening in 2020, you know, in this century, we live in a time where we look at data. We look at what does the data tell us? So it's evidence-based medicine. We don't operate anymore, and let's just see what happens, and and hope for the best. So yes, we have data that suggests that hydroxychloroquine does have antiviral effects in a test tube. We have some data that may work in certain animals. However, in medicine, the way we practice, we look at randomized clinical trials. Now, early on when this was hitting, we couldn't say that, hey, we're in an ivory tower, we have to wait for the data to come out. We wanted to try different things. But to make sweeping generalizations in terms of whether it works or doesn't work, we have to look at randomized clinical trials. We have to understand that, yes, there is some antiviral activity, but also understand just what works in a test tube or in a cell culture or in other animals, whether they're monkeys, macaques, etc., doesn't necessarily mean it'll work in humans. We like to see human trials. The reality is that probably it does have some modest effect early on in the course of disease. Later on, I don't think it has any effect, and that's been our experience clinically in multiple medical centers in the tri-state area. There's certainly no data to suggest taking it prophylactically, that is just popping a pill like you would a piece of bubble gum every day, would have any efficacy. So again, all these interventions need to be vetted, right? Because everything in medicine it's never black or white. There's a lot of gray. We also have to understand that everything in medicine, whether it's an antibiotic, it's an anti-inflammatory, has side effects. In terms of hydroxychloroquine, it can cause cardiac arrhythmias. Yes, it has been used extensively for things like lupus or rheumatoid arthritis. Hydroxychloroquine is a safer metabolite of chloroquine, which has been used the world around for malaria. So yes, it's a drug that's very ubiquitous. It's been used very often, that we have a lot of data for. But to really strongly say one way or other, just talking scientifically here, we really need to look at more randomized clinical trials. That is, some people get it, some people don't. These are placebo-controlled trials, and they're double-blinded, which means the person and the scientific investigator, neither one knows what they're getting, whether they're getting a sugar pill or they're getting hydroxychloroquine. Only then can we make really definitive generalizations. So, there are, I would happy to report, many clinical trials going on as we speak. I happen to be very fortunate to be in a medical center that are part of several of them. I am investigating several drugs as we speak, as are many medical centers across the country and globally. So, we're very fortunate that we live in such a connected world where you can have data flowing freely. But we have to wait for that data to really and look at it from a statistical point of view, and wait for that data to come in and be analyzed before we can make definitive sweeping generalizations and sweeping recommendations. So I would say this is a treatment in evolution, if you will.
Would you prescribe hydrochloroquine or take it yourself at this point?
Sure. So, if we look at our own protocols, which we've refined over time, we looked at the Chinese data. So our own protocols and many medical centers' protocols have changed as our understanding of the disease has changed. For instance, in the beginning, many medical centers were very interested in reports from China coming out that an old HIV drug, ritonavir, which is the trade name is Kaletra, had some activity against COVID-19, or SARS-CoV-2, which is the virus which causes COVID-19. Our own medical center, we used that initially as part of our treatment paradigm. We very quickly realized that in our own experience, it wasn't effective. We did move to things like azithromycin or Zithromax and hydroxychloroquine. We also understood very clearly and very quickly that there were different phases of this disease where perhaps it had some efficacy, again, very modest at best, early on in the course of disease, maybe preventing people from being hospitalized. But people that were coming in, they were with respiratory distress, we realized, no, it has no efficacy. So you understand that there's a danger of just blankly saying, take it and see what happens. You have to know what you're treating, when you're treating it, and when it may be effective and when it may have no effect and actually cause problems down the road. An easy example, COVID-19 affects throughout, not just the lungs, it affects multiple organs in the body, including the heart. So later on in the course of the disease, we have seen patients develop arrhythmias. That is, the heart doesn't contract properly because it gets enlarged. We call that cardiomyopathy. In that case, hydroxychloroquine and zithromax put together could actually cause more harm than good. So as everything in medicine, do no harm. We have to really leave it to medical professionals and science to understand when to use it, when not to use it. And really, I exercise caution for anyone out there to just take something you hear in the media and just run with it and say, let me just take it and see what happens.
Got it. Doc, I'm going to have you hang with us here for a minute because I do have some other questions and I want you to hear what some of our other guests have to say tonight. But I want to go over to Sister Nancy Downing, who's the Executive Director of Covenant House here in New York. Sister, how are you tonight?
I'm good, Chris. How are you doing?
I'm excellent. Thank you. It was a pleasure to meet you today. As I mentioned earlier in the show, we were with Vinny Lavienne and the Emergency Task Force, who introduced me to you and the fine work you're doing at Covenant House. For folks who aren't familiar, what does Covenant House do? You essentially take in homeless youth and then try to transition them through a number of phases into mainstream life.
Yeah, so Covenant House has been in existence for about 50 years now, serving homeless youth, trafficked youth throughout 31 cities in 6 countries. We're in many cities in the United States, New York being the first city that we opened in and probably the largest program that we have in our federation. We provide services such as, residential services for our young people, shelter, transitional living, and apartment living for our youth. At our site, we have a federally qualified health center as well. So we have medical professionals right on site to assist our young people. We have a lot of mental health professionals that we're working with as well, psychiatrists and licensed social workers who work with our young people. Many of them have been traumatized, either by their experience of being homeless or through traumas at home, domestic violence, experiencing trafficking and other such traumas. And then in addition to those services, we provide employment and education services, additionally youth development services, legal services, a number of services for our young people, and including arts and music, all of those kinds of things for them.
So as if you're not dealing with a population that's not already vulnerable, toss COVID-19 into the mix, both in your residential facilities as well as the apartment transition facilities you administer and other outpatient services you give. I mean, it's challenging on a good day, much less with this. How have you been coping, and what has been the impact on the population you serve?
Well, for the young people, it's been very traumatizing. We had one young man the first day that we were experiencing, the COVID developments as they were coming along. We found him crying in the elevator, and he started by saying, I've had all of these terrible things happen in my life, and now this. And he just broke down in tears. And so it's created some additional stress, obviously, and additional trauma for our young people, which we're dealing with through our social workers and our psychiatrists and other mental health professionals to make sure our young people are getting the emotional health care that they need at this really challenging time. For other young people, they've lost their jobs, so they've just gotten their life together. They're on a great track. They've gotten good employment. They're living out in their apartments, and now they've lost their job. And so it puts them back a space, so that they're struggling with that trauma of just having lost their job just as things were getting going. And so we're having to be out there again with them, making sure that they have the food that they need, the supplies that they need, the masks that they need, everything that they need to be able to survive during this very challenging time for them.
How important was the emergency task force in supplying you? We saw Vinny Lavienne and his troops drop off some thermometers today, for instance, and something as simple as crates of chocolate for these young people who may not have had a treat in a while. So you have the medical equipment and the emotional equipment, if you will.
Well, the medical equipment obviously has been very, very helpful for us. Those first weeks were really challenging. We didn't have the PPEs that we needed to be able to work with the young people, some of whom had symptoms. We didn't have, the thermometers to be able to test folks as they're coming in the door, our staff and our young people, to make sure that they weren't running a fever and presenting issues that needed to be dealt with. And so those things have been really great. But in addition to which, we're trying to keep things normal for our young people, as normal as we can. So having that treat today of chocolate coming in the door for our young people was great. They were so excited to get it. Of course, we're dealing with a sugar hangover now with them, but no, seriously, they really were so grateful for it and just so excited.
You've got a challenge, though, because you've actually got young people who are COVID-19 positive living in your facility. It's incredibly infectious, and not only to treat, but to contain this, decide who needs further medical treatment to keep your program rolling. It's got to be mind-boggling to deal with.
You know, it's been a challenge to figure out all of the different processes that we've needed to put in place. So, you know, from people coming through the door, that young person when they first come through the door, we now have our medical staff when they're on site meet them to check out and make sure that they're healthy, that they're not carrying the virus, that they're not running a fever or having other symptoms of the virus or other medical issues. And if our medical staff are not on site at the time when they come, we bring them up now to a quarantine or wellness room for them to stay until we can have a medical staff check them out. So we're not bringing someone who's sick into the population of our residences and getting other young people sick. We've had to adjust our space for the young people. So in bedrooms, we typically would have 3 or 4 young people. Now we have 2 or 3 young people so that each bed is 6 feet apart from the other bed. So we're thinking through those kinds of things, making sure we have masks for our young people and for our staff, and making sure that they're wearing them and wearing them properly, those kinds of things. Making sure that we still are carrying on some of the day-to-day activities that we want to be carrying on, the education and employment activities, but doing it in a way that sometimes we're doing it via internet, sometimes we're doing it in small groups. So when I say small groups, it might be 2 or 3 young people separated 6 feet by space, but also wearing their masks. So trying to adjust in those ways. Our office spaces, we don't have offices right now. We have wellness rooms for young people when they get sick. We've been very fortunate. We've had only 10 young people who have tested positive, all of whom have gotten well and have been reintegrated into the residences and are doing fine. So we're very grateful that we've got great medical staff and great staff who've taken really good care of them.
All right, sister, stand by with me for a minute because I want to bring in 2 people who represent sometimes the most unsung, I think, of the frontline heroes in all of this. And John Samuelson represents the Transportation Workers Union, and Michael Greco represents the union, is the vice president for the union that represents the paramedics and the EMTs at the Fire Department of New York here. Gentlemen, thanks for being here. It's tiring. I'm going to start with you, John. For you, I'm sure, to keep up with everything, you've got people who operate buses, people who operate trains, the conductors, you've got mechanics for the airlines, you've got flight attendants on JetBlue. Are people being properly cared for in these jobs? And give me a sense for the effort you're leading to make sure that these people who can't take a day off in many cases, how is that effort working?
Well, so we represent 150,000 or so transport workers in every sector of the transport industry across the country. And we're now months into this fight against COVID-19. And there were so many battles early on that hopefully we've won and we've put them to rest. And we march forward with the proper personal protective equipment and safe workplace practices and whatnot. But that was not the case early on. Early on in this battle, everything was a life or death fight with the employers, whether they be in the public transit industry or throughout other areas of the transport sector. And in fact, the TW itself is the entity that first gave out protective equipment at New York City Transit and in the airline industry where we represent workers, and in the railroad industry and in transit cities across the country. So it was the union that actually stepped up and got this personal protective equipment out to our members. And as of right now, the fights are almost behind us. The fights right now are about sustaining the victories that we've won previously, and not to underestimate the ability of any employer at any moment to not provide personal protective equipment. We know that can happen, but the fights are largely behind us, we hope. Although there are some exceptions to that.
John, what toll has this taken on the people who drive the trains, drive the buses, work on the trains, work on the planes, these essential modes of transportation that just can't stop even with a pandemic that causes self-isolation?
Yeah, well, isolation for transport sector workers. We don't have that luxury. We're out there on the front lines every day, along with all the other essential workers that we're bringing back and forth to work. So no, there's very little isolation for us. And in fact, the pandemic has really taken a massive physical and emotional toll on transport workers across the country. Every day we come to work and the feeling in the air, still now, several weeks, months into this, the feeling is still like the day after the September 11th attacks. There's an ominous, surreal feel in the air. The over 130 MTA workers in New York City have perished due to COVID-19. 112 TW members across the country in the airline industry, in the transit industry, city by city, have perished. This is a surreal, hopefully once in a lifetime situation. And words can't describe what transit workers go through, what airline workers go through when they put their lives on the line every single day and have to worry about perhaps bringing this virus home to their parents, to their elderly parents, or to their children, or to their spouses. That's really the ultimate worker's nightmare, is bringing the disease home to somebody that you love and infecting them.
What have you seen, John, that's disturbed you most about the conditions in which your members have had to work?
So most disturbing, absolutely for sure, is the flagrant disregard of some employers to not only to the health and welfare of their own workers, their employees, but to the health and welfare of riders of systems. And we've seen that demonstrated many times during this pandemic. And in truth, we've seen the opposite as well. We've seen employers step up and absolutely really do the right thing. In fact, you mentioned JetBlue before, and we represent flight attendants at Southwest and Allegiant as well. But JetBlue was the first employer to work with the union to step up and issue a requirement for facial coverings to get on planes. So we've seen employers do the right thing, but as many times as we've seen them do the right thing, we've seen them do the absolute wrong thing. And one thing in our industry in particular that's been brought into clarity by the pandemic is the difference between privateers that are contracted to run public transit systems and true public sector systems with public sector workers. The privateers are only in this to make a buck. They will expose somebody to harm's way without giving it a thought if it means that they can up their bottom line by a couple of dollars. It's a very unfortunate situation. And going forward, it's something that we're really going to have our mind on, and we're going to work hard at trying to put limitations on what private operators can run public transit, because it's just simply not healthy for society for public transit to be a profit-making industry.
How are the transportation authorities, some are government, some are private, as you mentioned, doing when it comes to keeping the planes, the buses, the trains clean? There's been a massive effort here in New York City, as you know, to sanitize the subways. Metro North, the trains that go between the suburbs and the city, there's been a big effort there. The planes, I flew on Sunday from Detroit to LaGuardia. I'm guessing that that plane, that A320, has never been cleaner in the last 3 or 4 months it's been in service. Are we winning on that angle there?
I believe we are winning. I believe that the employers know, whether they be private sector or public sector, whether they be airlines or transit or Amtrak for that matter, they know that in order to bring riders back into the system, in order for passengers to start flying again, there needs to be a confidence among the passengers that the passenger carrier is doing everything they can to keep the planes clean and the trains clean. And I think that the systems are a lot cleaner than they were just a few short months ago. And these decontamination efforts, these disinfection efforts have to be enshrined permanently as we go forward. If the systems fall back into a state of uncleanliness, the riders will stop riding. And those are the cold, hard facts that this is the new reality in COVID-19 for employers in the transport sector.
Is it safe for people to take trains, buses, and airplanes as we speak here tonight?
I believe it is. I believe it is. I believe that as long as common sense public health guidelines are followed, both in the system and in the workplaces for the workers, and as long as proper personal protective equipment is given out to transit workers, airline workers, and the systems are routinely decontaminated and disinfected, that we will have gone a long way toward improving the safety of the system and making it safe for folks to migrate back into the subway and to once again begin flying. So that's our goal. We share that goal with the employees. We want to see these industries come back. We want to see them thrive and be the solid area for blue collar workers to go for careers. And that's not going to happen unless the new reality is embraced by the employers.
John, I'm going to have you stand by. I want to bring in Mike Greco. Mike is the vice president of the union representing paramedics and EMTs, inspectors for the fire department in New York. I can't imagine the difficulty of being a paramedic in the early stages of this pandemic, by all accounts, not having the appropriate personal protection gear and having to go into a home with a suspected gravely ill COVID-19 patient and having to deal with that, do your job, get that person to the hospital for proper care, and then have to worry not only about yourself, your family, but maybe infecting the next patient who is not COVID-19 positive. All this before we had a test, all this before we had a treatment protocol, all of this, as I mentioned, without the proper personal protection gear. That's got to take a toll, Mike.
In the beginning, that was and still is the worst part of it. Everything we do, we're trained. I'm trained to take care of a tuberculosis patient. I'm trained to walk into a hazmat scene. We're trained to do an assortment of treatments in an assortment of environments. But that all comes, part of the training is scene safety and BSI, body substance isolation. That is the cornerstone of what we do. I can walk into any situation if I know my PPE is strong and my training is sound. Well, the training was sound. The PPE preparedness was disgusting. To sit there as a frontline worker and expect that the supply would be there when you're in the medical field as a first responder, it's just not something we thought about, that a simple mask was not going to be in a warehouse somewhere.
Why is it, though, and help me to understand this, Mike, that your people, your union, John's people, John's union, didn't have the ability to go to the city or the state or anywhere else and get this gear? Why is it that you had to rely on Vinny Lavienne and the emergency task force and his vast network of connections to get you the gear early on in this pandemic? Well, how is that possible? I mean, thank God for Vinny and the emergency task force, right? But how are we even in that situation? How could nobody have been prepared?
The simple answer is, in a union perspective, or my role, I only care about safety. It's my only job, to protect my members. So unfortunately, when you get through the red tape of whether it be the federal government, state government, local government, billion-dollar municipal agency, common sense is the enemy of logic. So I don't understand why the person whose job is to sit in a room and think this, where was he? I would have thought for sure, if you would have told me 5 years ago, 10 years ago, when I'm doing my hazmat training, that if something like this would have happened, somebody sat and thought that this is going to happen one day. We're in the medical field, a global pandemic. Let's keep 1 million N95s in a warehouse. And we just understood that. I can't imagine, I've never been in the military, but I can't imagine a frontline soldier thinking the bullet is going to run out. It's, you know, there's 7 guys behind an infantry soldier making sure the bullet is there. For some reason, we didn't have the 7 people sitting there preparing for this. Where were the tabletop exercises? You know, we have response plans for the chlorine factory in Jersey. If it happens to explode, what are they going to do? Buildings collapse. We have response plans for that. You mean to tell me in the largest city in the world, in the largest EMS agency in the world, nobody sat there and thought about what would we need if a global pandemic shut down the city? Nobody was there. So it's somebody dropped the ball. I don't know who to blame. I don't know if it's a federal government, but the fact of the matter remains that it wasn't there. So it took the union, it took our friends and family network of donating supplies. The fact that I had to drive around station to station with N95 masks that we secured from one location to another, and had to be told that don't allow the donations to go to the fire department. We had to get it at the union. We had to go drop it off because they couldn't vet it or whatever. Our members needed the protection. So I don't have the red tape. The union doesn't have that red tape that a state, municipal agency, city agency. So what we did was we did what we have to do to keep our members safe, just like my members did what they had to do to treat the citizens of New York with the record-breaking call volumes. I mean, when the end of this, the frontline workers, my EMTs and paramedics, the transit workers, everybody who did not sit at home and do their part because they were non-essential, everything we did with bravery. They did with tremendous professionalism. They did their job. Somebody who didn't do this.
What toll has this taken on your membership, on the paramedics, the EMTs you represent, death-wise, illness-wise?
Yeah, there's a mental toll that I struggle with every day now to figure out how to address. A cardiac arrest, a child passing is all part of the job we do. There are certain mechanisms in place that we're all inherently learned to cope. But due to the death amounts and the amount of calls that came through on this, it's tough to tell what that long-lasting mental effect is. So that is now the next phase of this, recognizing that post-traumatic stress is something that's recognized 30 days after an event. And it can take weeks, it can take months, it can take years to develop. So what we need to do is put a system in place that will address that, whether it's a peer counseling, the training, get multiple agencies involved, get the studies involved. We need to prevent the overriding effect of this much death to create such a heavy burden on a first responder that they lead to the worst case scenario. And that worst case scenario is obviously suicide. What's
the most tragic thing you've seen, Mike?
The most tragic thing I've seen is just knowing that 4 of my members in the EMS side have passed, 2 of my fire inspectors, and 1 of my members have passed away for suicide. So in suicide, that is the most tragic, that's endgame. There's no coming back from that. Multiple services are going to have this problem. You talk to a nurse, you talk to a doctor, you talk to a cop, you talk to a fireman, you talk to an EMT, a paramedic. It's the worst thing. Human death is not something that we are supposed to experience on a multiple level scale. So first responders, they do it all the time. And you slowly build up a callus and a disassociation. There wasn't time to build a callus to 14 cardiac arrests in a day. There wasn't even time to finish cleaning your ambulance before the next person's dying. So there is an unrealized psychological toll that is going to be the new 9/11. We're going to need resources the level of the 9/11 Commission, the level of financial resources like the 9/11 Victims Compensation Fund, because we don't know the 2 areas that are going to affect from this: the mental health, and the studies aren't out yet to what this virus is doing to those who contract it. Why do I have a 30-year-old that has a new onset CHF, congestive heart failure? Why do I have 35-year-olds right now who are dealing with strokes? Why do I have
strokes at 35 years old?
Yeah, and there's a post-COVID positive test. So they positive for COVID. They had their 2 weeks, 3 weeks of symptoms. They're having shortness of breath. The shortness of breath didn't go away. Finally, somebody convinced them to go, get another test done, and it turns out they have a pulmonary embolism. So there's a clot in the lungs. Then we have another person who there's a stroke in the brain. One guy has fluid around his heart. These are young, healthy first responders. So the studies are going to come out. And there's going to be, and we have a doctor on, he's going to do the study. It's science-based. They're going to find out, just like the air was safe in 9/11, and then they're going to turn around and realize the cancer clusters and the amount of death and destruction that came from that building collapse. We don't know the science yet of what is going to happen to members who became positive, and are they going to have diminished lung capacity? Are they going to have kidney failure? Are they going to have, there's an assortment of research that needs to be done. They didn't take care of us. Sorry.
Go ahead.
They didn't take care of us enough in the beginning to prepare for it. Are they ready to take care of us when this is researched? And that's one of my biggest fears.
Obviously, the number of fatalities is much higher from this pandemic than from 9/11, but the long-lasting psychological trauma and toll, is that going to be worse, do you think? As horrific as it was after 9/11 and still is this going to be even worse?
I don't want to put a worse or a, this isn't a competition where I wasn't at 9/11, so I am not going to diminish what the paramedics and EMTs who were on that pile retrieving body parts, what they saw that day and that recovery. It's not a competition. So I do not want to diminish an effect like 9/11, but I also don't want to diminish what it's like for an EMT and paramedic to deal with 7 cardiac arrests in a day. It's not even just the death. People are scared to go to hospitals. They're still scared to go to hospitals, as well as they should be. So how do you resolve the fact that the protocols changed at that time? That somebody who you can refuse medical attention for, if they had a legitimate medical issue, you would call a doctor and have a doctor consult with them before you took that RMA. During the peak of this, as long as they had decisional capacity, you were able to accept the RMA. That person dies a day later. How do you resolve that in your brain?
How do you? What can you do to help your people on the front lines here?
Well, you talk to them, right? It's the best I can do. I've reached out every chance I get to try and talk to somebody. Just let's talk it out. Let's figure out what you're seeing. The ability to speak about what you saw is in and of itself a stress relief to know that there are other people that are going through it. Right now, the normal coping mechanisms aren't in play. Whether you're somebody who likes to go have a drink at a bar, whether you're somebody who likes to go play pool, do you like to play poker? Do you like to go out and eat? Do you like to go bowling? Do you like to play pool? Or do you go to the gym to work out? What is it that you normally do to help decompress? Family life. My mother is downstairs in my apartment that I have not been within 10 feet of her in 2 months. My sister had a newborn baby, a niece that I now have, that I've been able to hold once because I put me and my wife in a full-on hazmat suit. Family, I know my family would be shocked to say this, but my family is a stress relief at times. That is a coping mechanism. It's the ability to do your normal day-to-day operations, to forget about work. Work is now coming home with us. We have members who in the beginning were sleeping in their cars. The department stepped in and got hotel services. So they were able to at least quarantine at a hotel for a couple of months. Some members have sent their kids to as far away as South Carolina and Florida, and they haven't seen their kids in 2 months. I'm not a parent, but I can't imagine what it's like to have a 7-year-old child, my daughter or my son, and know that I can only FaceTime them. All the while, I'm taking care of the citizens in New York. I'm taking care of the first responders, the COVID patients. And then to find out members are dying, and what are we doing? We're fighting for health insurance. We're fighting for health insurance for the families. We're fighting the government on what is this a line of duty, when it's not a line of duty. So these are the tolls. There's multiple types of stresses. There's physical stress, there's mental stress, there's organizational trauma. There's so many different traumas going on with this pandemic that it's going to be researched for months and years to come.
You talk about the case of a suicide in your ranks, Mike. As best you can, share the circumstances surrounding that as a cautionary tale.
Well, the cautionary tale would be, I mean, I know that nobody wants to make this a poster child of this event. So any sort of mental illness, any sort of event that leads, it's never a this was the event that led to it. This particular gentleman just got on the job less than a year. So maybe he didn't have the coping skills to deal with what he saw. There could be life issues that he's going through. There could be an assortment of things. But to put somebody through this and have it lead to that, you have to make sure it doesn't happen again. And if I have to sit there and deal with that just one more time, I'm going to feel like that's a failure. I'm going to take that. That's a stress that relieves, that weighs heavy on myself as well as the union's mind. The one good thing I can say, I know I'm very used to killing the government and killing the department's response and the start. They are receptive right now. Whether it's a peer counseling we're trying to start, whether it's figuring out how to utilize our counseling service network. So I say all this with anger from the beginning, and there is a process hopefully moving forward. So I'm cautiously optimistic that the agencies needed to be involved are going to be there for us. But like my counterpart just said, you can't take your foot off the gas. You have to make sure that the second we take a step back, they'll take an inch, they'll take a yard. So it's a constant battle to make sure that they're held accountable. My members would hold me accountable. It's my job to hold the city of New York. It's my job to hold the fire department. It's my job to hold everybody else accountable for what they have done and how they're going to make sure that they don't do something like that in the future to the members.
Mike, I want you to hang with me for a minute. John Samuelson of the Transit Workers Union, as crippling as this has been physically, emotionally, economically, could some good come out of this? And what do you hope happens next for your people, the vast array of transportation employees you represent?
I think there is some good that has come out of this. And certainly in the midst of protecting workers during this pandemic, workers joining together collectively and defending themselves against employers that thought nothing of giving instructions that would put them in harm's way. So I think certainly a good thing is that workers across this country have come to understand that when they lock arms and stand together, they can defend their health and safety, they can defend their livelihoods. And that's going to lead to an emboldened workforce in America. And in my mind, that's certainly a good thing. Rather have not gone through this pandemic, obviously, but one of those, I guess, outcomes at the end of the pandemic is that there's going to be an uptick in union organizing and union membership, and it's cold comfort, but nonetheless, that is a reality. For all the strike action and threats of strike action that went on in the midst of this pandemic to defend workers, workers will come out stronger.
Sister Nancy Downing, I want to go back to you for a minute and ask you a question about coping, and not just there at Covenant House, but as a woman of faith, what do you tell people about dealing with the day-to-day struggles? We heard about a paramedic committing suicide. We hear from John Samuelson, the stress and the pressure of transit workers. Dr. Saggar, who has been dealing with this on a day-to-day basis, and his team and teams like his all across the country. What do you tell people about faith and the role faith plays in getting through an unprecedented event like this?
I think for me, faith plays an important role. Having that sense of hope for the future, that sense that there's something bigger than us out there, that that God that loves us and that cares for us and that will be there to support us through this trying time. So for me, that gives me strength and hope and courage. I do want to comment on the fragility of our young people in terms of their emotional fragility. So when I was hearing Mike talk about the PTSD, certainly among the emergency workers, I also look at these young people and the trauma that they've suffered before this. But now with the virus as well, and them already being in an emotionally fragile state, we have to pay very close attention to that for these young people, as we do for the workers here and our own workers, making sure that they have the emotional supports that they need. It's been a trying time for them, and they've been very courageous about coming in every day and being there to support our young people.
You know, you mentioned young people. You may have seen a young man get up behind me. That's my eldest son, Chase, who is in the television production business and sometimes works with me. And he was working with me today on this project. You know, and as a freelancer who usually has a ton of work, ranging from my stories to Gordon Ramsay to, you know, Flea Market Flip, a lot of young people have been out of work for weeks and weeks and weeks. Now, the government has stepped in with benefits and aid and assistance and you know, paycheck protection, but there's a lot of time on kids' hands these days.
There's a lot of time on their hands, but as we saw with the last economic downturn, our young people were left out in the recovery initially. So for at least 2 or 3 years in the recovery, our young people couldn't even get, you know, basic jobs, you know, minimum wage jobs. And so I hope that as we begin to look forward to recovery economically, that our young people won't be left out of that recovery again, that we recognize that they need employment, and that the more employment that experiences that they have, the more successful they can be in the future. So I'm hoping that we'll pay attention to that during this economic recovery. And certainly we as an organization are paying attention to that and trying to prepare our young people for the employment that will be coming back in these next months ahead. So we try to keep them busy with education and employment readiness so that when the jobs come back, they're ready for the jobs, and hopefully those jobs will be available to them as they are to older workers as well.
Dr. Suraj Saggar, you have been on the show 3 or 4 times now and have been in many ways the voice of reason and medical knowledge and perspective here. How are you doing tonight? What toll is this taken on you and your family? How do you feel?
Sure. And before I answer, Chris, I just want to comment that, you know, all your guests tonight have given just absolutely fantastic and spot on views in a very unique but yet very complimenting manner. So I just really want to, you know, I listened to them, you know, incredibly, just each one of their unique stories and how it just really shows how this pandemic has affected everyone, not just medically, but socially, but spiritually, economically, etc. So, you know, my hat's off to everyone for sharing their comments. As far as me, you know, I'm a medical team and nurses and doctors and others on the front line. As your guests have mentioned earlier, there is the aspect of PTSD. There is the aspect of moral injury, of now that things have slowed down, that we can finally reflect on what it is we've seen, what it is we've been forced to do. Of course, you know, in the medical profession, we all swear an oath, and our goal and our focus is always on our patients. But we always have to make sure we take care of ourselves. And, you know, now that things have slowed down slightly, just today at lunch, talking to other physicians, you know, we say, gee, in the beginning, we were so wrapped up in just triaging patients, treating patients, and moving on to the next issue that you almost didn't have time to think about what's the impact on you personally. Now that we're able to have some time to reflect, it is actually, and I can speak for myself, but I think most likely echo sentiments from many of my colleagues, one of the most, if not the most trying time in our careers. I mean, none of us could have foreseen the speed and the veracity of how this hit us all. You know, we've used the figurative speech of a tsunami, but it's essentially what it was: a tsunami of patients coming in, a tsunami of high acuity patients. You know, and we're all used to seeing older patients, unfortunately, sometimes succumb to their illness. It's not so common that we see 30, 40, 50-year-olds, those with young families, those with young women, children, those with young wives that are sole breadwinners of their families, ultimately succumb to the disease. So it was incredibly traumatic for all of us. And I think, as been echoed about many of your guests, going forward, we really have to understand the broad socio-economic as well as psychological impact that this virus will take. Of course, we talk about the medical and physiological impact, but we have to also be attuned to what this is going to, you know, the issues this will affect down the line. So that will only be realized, I think, in real time as time goes on.
At the end of your long day, stressful day, taxing day, Doc, what are you most thankful for, and what do you pray and hope happens in the near-term future for our country?
I'm certainly very thankful for my family, which without them, I wouldn't have been able to survive. Certainly, very thankful that I didn't bring this dreaded disease home to them, which, I would say anyone in the healthcare field, EMTs, firefighters, policemen, doctors, nurses, respiratory techs, what have you, this is something in the back of our minds. We accept the risk, but to think that you can bring this home to your wife, to your child, to your husband, to your loved one, to your parents, etc., was extremely trying. So I'm very thankful for that, and I'm very thankful that we have a healthcare system here and people that are willing to put their lives on the line, to put their lives on hold and treat others. So I'm really thankful to be just one cog in a wheel, if you speak. Nothing special. I've always wanted to be a physician my whole life, and I'm glad I was able to become one. But I'm also extremely proud and grateful to work with colleagues from all across healthcare, all across first responders, firefighters, policemen, everyone, EMTs. It's really truly a brotherhood of in terms of a profession, and I'm very thankful to be a part of that, and to at least have the honor and the opportunity to play a small but hopefully a vital part.
Any advice, Doc, to the paramedics and EMTs out there, to the transportation workers, to the people trying to build a better future for our young folks who are in very vulnerable, challenging situations?
I mean, I think as a sister can attune, have faith, whatever that faith might be. Have faith that what you choose to do as a career, as a profession, is indeed a calling, and you're making an incredible difference, no matter how hard the situation may be. I mean, I'll give you an example. There were times that mentally, physically, I was broken, but I would get a card or an email or a text or a Facebook message or something, and I will tell you, it's those small things that carry you on as you go from day to day and try to make an impact in this world.
Michael Greco, when you go to bed at night, what's your biggest fear? What's your greatest hope?
My biggest fear is that, somebody that I care about, I bring this home to, which is why I've been almost militant with the keeping my family away. Me and my wife actually had to have a conversation of how we were going to deal with this. And so we've decided to quarantine together and basically ride it out. But I know I have members who brought it home, and their parents have died. So that's definitely the biggest fear for all my members. To echo what the doctor said, we signed up for this. I got into the medical profession. I'm a paramedic. I signed up for this. It was an inherent risk, especially you become HAZTAC, you can do all those things. My wife didn't. My mother, my sisters, my brothers, they didn't sign up for it. So that's the biggest fear. The hope is easy. Just look at the coworkers. Just look at your members. Look at everybody who's going through this. As with the heroic, the bravery, with the ability to just shake it off in a way that is almost Stockholm syndrome-like. We do 7,000 calls. We break records. Then we do another 7,000. By the third day, our members look at you and we're just like, hey, it wasn't that bad today. We get so used to
7,000 calls and not that bad.
Yeah. But by the third time, it's almost like a Stockholm syndrome. Like, I'm sure it happens in the ERs too. Your beds are full. You've never seen anything like it. By the time you do that 3 times in a row, it becomes, okay, this is the new norm. Our ability to adapt, our ability to overcome, our ability to see what the problem is, solve the problem ahead of us, and just know that no matter what is about to come, despite lack of support, total support, community support, no community support, watching coworkers and watching members and watching the frontline workers and everybody who's been involved in this take the punch right on the chin and just move right through it. It's a testament to the work, our profession, and it's a testament to the city of New York. It doesn't matter what you throw at this city. We take it on the chin and move over. So that's the biggest fear. That's the biggest hope.
John Samuelson, I, like many other Americans, will get on a plane at the end of this week, if not probably in the next 2 weeks. We're going to have to make decisions about getting on trains, buses. For a lot of people, especially here in New York, that's the only way to get around. In Detroit, a few weeks ago, I was there when saw a bus driver died of COVID-19 after a passenger sneezed on the bus driver. He did a Facebook video on it. What should people know as they try to get back into some sense of normalcy with mass transit flying?
Transit workers have really, in the most profound way, put their lives on the line. Transport workers in general have put their lives on the line. There's hundreds of deaths by transit workers and transport workers across the country who have embraced our obligation to deliver essential workers to the front lines of this fight against COVID-19. And that respect should be given, and as well to all the other frontline workers. And also, you talk about hope and thankfulness, and I'm thankful today because this has been the first day in quite some time where a fatality hasn't been reported out to me within the Transport Workers Union, and that I'm thankful for. I'm thankful for this new surreal world we live in. That when I wake up and then go to bed at night and a fatality hasn't been reported to me, it's been a good day. And
did you ever think, John, that in all your tenure it would be a good day just because there was not one single fatality in your tens of thousands of people you represent?
No, never. And you know, many of us, particularly from New York City, lived through the World Trade Center attacks, and at the time said there'll never be another event like this. And I'm through in my life with saying this is a once in a lifetime, or there'll never be another one like this, because this is so unexpected. It came out of left field, and it has wiped out families. It's wiped out workers, and it's an unseen enemy. It's not even like the zombie apocalypse where you can actually see what you're fighting. This is an unseen enemy, and it's what makes it so scary. And folks have perished by an enemy that they weren't even able to lay eyes upon. And that itself is very scary.
Sister Nancy, because I spent part of my misspent youth in Catholic schools, I'm going to give you the last word tonight. I feel that's the least I could do for you for being such a dedicated human being in this effort. What do you want people to know most tonight? What are your final thoughts?
I think that we're in this together, and that we're going to get through this to the other side. We're going to get our young people through this. We're going to get each other through this. Let's support, pray for each other, care for each other, and be safe and be smart about making sure that we're wearing our masks and doing all that we can to protect each other.
All right. Sister Nancy Downing of Covenant House, Executive Director, thank you so much for being with us, as well as John Samuelson of the Transit Workers Union, Michael Greco, the union representing paramedics and EMTs here in New York City, and Doc Suraj Saggar, thank you again. Stay safe, stay healthy. I appreciate everything that you do. I truly have the easy job in all this, but I can't get the word out without folks like you, and I thank you from the bottom of my heart. My thoughts and prayers are with you all. Have a good night, and we'll speak to you very soon.
Thank you.
Thank you. Stay well.
All right, guys. Appreciate it very much. So, another trip to the front lines of the COVID-19 pandemic. I'm both comforted and alarmed every time we do one of these shows. I figured we'd do one or two in the very beginning, and tonight marks the 10th special episode of Have a Seat with Chris Hansen. And I want to thank each and everyone who's participated. Special thanks to Vinny Lavienne, who chauffeured me and my crew around all day today, and you'll see that special report coming up very soon once we put it all together. Tomorrow night on Have a Seat with Chris Hansen, we're back into the world of Dobby Vanity. We actually have a crazy week coming up. We've got some interviews that, well, as you see tomorrow night, are just absolutely mind-blowing. There's no other way to put it. We also have some interviews that I've already done on the Onision investigation, the YouTube psycho brat from Washington State, and we're putting those together for a show that we'll probably do later this week or early next week, in a topic that I can't even explain, having to do with a YouTube content creator named Wes Most, who's a good guy and a friend of the show. So you'll likely hear from him on a special edition coming up later this week, and I'll have news on that tomorrow. In the meantime, I hope you're all getting through this. It's taken much longer than anybody could have ever imagined. Stay safe, as I said, stay healthy. Remember, I'll be watching, and I'll see you tomorrow night right here on Have a Seat with Chris Hansen.